everybody. Today we're having Autoimmune Table Talk, and this week the biggest question of the week was really about brain fog, okay? And there were over 200 comments in the Facebook group about brain fog. And today I loved all the comments and everything. We're going to talk a little bit about that, but I really want to shed the light on what is brain fog and what the heck can you do about it? How do you fix brain fog? And why is it important? So I'm just going to go over right now, like looking at the Facebook group, a couple things. What are some common descriptions of what brain fog is? And this is directly from your mouths, people. So Ryan says that it's an inability to recall a certain word on demand that is part of your working vocabulary. I just felt stupid because I couldn't talk like I wanted to. How many of you have had that, right? T says, after a while, the person talking sounds like Charlie Brown's teacher. If any of you can recall that. So basically there's difficulty with focusing, concentrating, and memory. Boy, and then Brittany says, almost feels like being intoxicated, not fun. Okay, Brianna says, the scariest one I've had is a sudden blank when I was driving. I couldn't remember the path I was taking, although I've took it many times before, and I couldn't picture the exits or road ahead, so I panicked. It was a total mental block. I actually want to welcome a lot of people into our Facebook group from the TBI community, which is traumatic brain injury community. Many of you have actually seen the interview I did with Amy on the concussion discussions. If you haven't seen it, Cora is going to put a link in the comment section. And I discussed in there a huge role of why is it after traumatic brain injuries, why some people recover fairly quickly and some people take a long time to recover. So I want to welcome all the people from the TBI community and concussion discussions in here. We're going to talk about concussion and the role of brain fog with that as well. So if you saw concussions discussions, please put in the comment section that you saw our interview there and tell me what was your biggest takeaway from the concussion discussions, okay? That would be awesome. Put it in the comment section. I love talking with you. I hate talking at people. I love talking with people. So would you guys please comment back, show me some love? That'd be great. If any of you are watching and you're not part of our Facebook group, Transform Autoimmune Disease Naturally, please join the group because everybody in the group, it's a private group. Go ahead and click search Transform Autoimmune Disease Naturally and join. People in the group gets first dibs to all the lives that I'm doing for Autoimmune Table Talk and any of these topics, including brain fog today. So join the group. So Ashley says brain fog is like having a significant part of your brain paralyzed, so you can't access it. Carrie says it feels like moving through peanut butter, trying to grasp thoughts just out of reach. Yeah, how many of you just can't even find those words? Word finding. How many of you is memory? Some of you have guessed what the causes are. Somebody was guessing that is it inflammation or fatigue, physical fatigue and mental fatigue. Daisy said, is brain fog caused by blood vessels in the brain being over relaxed and sluggish? And does caffeine make it better or worse? Some of the questions. Teresa said, I'm fairly confident that it's due to my blood sugar dropping. I can feel it happening. I feel very confused and my brain will not work. So Teresa, thank you for catching the bit about blood sugar. And if any of you missed my last Autoimmune Table Talk from last week, Cora can put a link in the comment section. That was about what time of day are autoimmune symptoms the worst. And there's a big discussion there about blood sugar and time of day as well. If you missed it, make sure you go ahead and catch it and watch it, all right? And Laura says, please discuss brain fog in terms of potential mitochondrial dysfunction. What does mitochondria have to do with it, and what the hell are mitochondria? Those are really good questions. Now, there's been a lot of us with brain fog. I mean, I'm describing you, and if I am, go ahead in the comment section and say why I'm describing you. Does any of this resonate and sound like you? If so, let me know in the comment section why. Some of the attempts that people have made to manage it. And I'm going to let you guys know, if you don't know what the heck is causing it, how do you manage or treat it, right? So that's why I think this discussion is really important. Laura G says, my brain fog is often worse after eating. She's done 3 gut healing protocols, probiotics and all. Nothing helps. I don't know if nothing helps, but I can see totally why Laura would feel that way. A lot of people are like, oh, it's all in the gut. Well, she's done 3 gut healing protocols. Does gut healing protocols, just doing them bring an answer to any sort of gut problems. Is that the solution? Just doing some gut healing protocols? Obviously for her it's not, right? It's because she's done it 3 times. Barb, who's had a TBI, traumatic brain injury, said, I've had brain fog ever since she fainted and broke her nose. And ever since then, it's been hard to concentrate. So if you actually had trauma to your brain, there could be actual physical damage there, but what can be done, right? Jennifer says it's gotten worse over the past 4 years since having her gallbladder out. What does your gallbladder or your gut have anything to do with it? And she's also had a diagnosis of Sjogren's, which brings up, does autoimmunity have anything to do with it? And so I'd like to bring up this discussion about brain fog and open it up about what are some causes. And this is a discussion in the middle of a Facebook group, which is Transform Autoimmune Disease Naturally. But as I'm going to let you guys know, this isn't just all about autoimmunity. There's huge other causes of brain fog as well, but it's absolutely worse in people with autoimmune disease. So I want to bring this to a larger discussion around what are some common causes of brain fog that could be reversible. So I don't want to just sit here and doom and gloom, be like, oh, you had a stroke 10 years ago and there are dead brain cells and now you're screwed. I don't believe that personally. I think it's really important. I think the brain has an incredible capacity to heal. And I don't care if it's happened now or it's happened 10 years ago. There's still ongoing brain repair that can happen. And so let's talk about what brain fog is for me, okay? I'm Maggie Yu, MD. I'm Maggie Yu, MD, and I am a functional and holistic medicine physician, 24 years in practice now. And my first 10 years was as a family medicine physician, and my last 13, 14 years as a functional holistic medicine physician. And I want you guys to know that for me, my brain fog and being a practicing physician came because of early menopause. And I really literally felt like I was freaking losing my mind. And somebody was mentioning how, the word finding was difficulty, memory was difficult. And numbers and math was always difficult for me, but really blanking out on birthdays was my own birthday, or not my own, but my kid's birthday or people around me's birthday. That was probably some of the early signs of brain fog for me. And as you can tell, what I'm leading up to is there was definitely a hormonal trigger for me, right? And I'll talk a little more about that. And then later on, when balancing my hormones helped, and then it didn't, later on, I found out I actually had an autoimmune disease, which is Hashimoto's, okay? And then on top of it, I was dealing with, at this time, more and more diagnoses, like fibromyalgia. And then put on top of that, 3 car accidents in a matter of a year, traumatic brain injury. So I'm coming from a place where the multitude of these adding on, and this is before I was 40, caused debilitating brain fog that actually caused me to have trouble functioning in a medical practice and as a doctor. So I think that there's a huge part of this about where there's a mindset piece of this, where when you actually start experiencing brain fog, there's many causes and the symptoms can be very similar and they can affect degrees, different people differently. The biggest piece I want to talk about too here is that it's a loss from a mindset piece. Mindset is a huge part of our program, Transform Autoimmune Disease Naturally, right? And the way that mindset is affected by brain fog is the loss of self-trust. How many of you know what I mean? Because if you do, please write it in the comments section right now. Self-trust. The loss of self-trust is critical in the downstream effects that it has on your overall health. Because think about that, when you don't trust that you can remember things, when you don't trust things that you do route, and suddenly it's a struggle to remember numbers, to remember why you were driving somewhere. I mean, that's the scariest thing, and I've experienced that. You're driving somewhere and boom, you're in the middle of somewhere, you're like, where was I going with that? So is that distractibility. And so backing up a bit, what I want to say is that I was also diagnosed with having ADD, which I'll be honest with you, I don't have. But it's really interesting how conventional medicine will try to diagnose and treat brain fog with medications and diagnoses that fit into a box. And I'm going to tell you guys, brain fog does not fit into a neat little box, okay? Which all of you have already mentioned, right? And Diana just says this becomes a struggle and it's frightening. Yes, absolutely, this can be extremely frightening. So what I'm going to say is my own journey through brain fog has included multiple diagnoses and affected by hormones, TBIs, and diagnosis of ADD, trial with ADD medication, and then not to also talk about mental health. I went through severe depression and a lot of trauma in my life as well. And there's a role of a trauma. And this is just something I'm going to throw out there, which is if you guys ever in the future, and we're talking about TBIs, which is physical trauma, but I really think that there's a role of emotional trauma that causes people to actually shut off their brain, to shut down, and to dissociate. So there's actually a protective mechanism that we have towards physical, emotional, or sexual trauma that actually causes us to shut down our brain as a protective mechanism. That is a contributor of brain fog. And if you guys are interested or can identify with trauma being one of the causative factors of your brain fog, like it was for me, and you want to talk more about it, please write that in the comments section. I'm open to discussing it, but not today. I will if there's enough of you that want to talk about it, okay? Anyway, from a medical standpoint, let's talk about number one. The number one cause of brain fog is hormonal changes in men and women. And hormones is not just your ovarian hormones with estrogen, progesterone, testosterone. And men have testosterone and estrogen and progesterone as well. This isn't just a women issue. Declining or changing hormonal levels in women and men can contribute significantly to brain fog. This is was a huge factor for me. And that's why for me, like this whole thing about and I was diagnosed with ADHD right around 34, 35, and I wasn't diagnosed with early menopause until I was 36. So how many people, kids, adult and men, women and men, are being misdiagnosed as having a medical disorder like ADHD and putting on multiple medications for this brain fog, inability to focus, when it's hormonal? How many teenagers are being overdiagnosed with having ADD or ADHD when it's their hormones going crazy up and down? So it's not just hormones going down, but when your hormones really go up, this is also why many kids are around puberty is hyper and can be diagnosed with having ADD and ADHD. So there's a huge hormonal component, and this is why for me, this ain't no BS small deal. It's really important to, number one is get your hormones tested, really understand and learn the role of hormones, and work with a very experienced practitioner to really get your hormones balanced no matter what your age is to deal with brain fog. I can tell you right now, for those of you in the TBI, post-traumatic brain injury community, there's tons of data that shows that after a traumatic brain injury, there's a huge role in the balance of estrogen and progesterone, specifically progesterone as being a factor that can actually really protect your brain and can help your brain heal. And this applies to men and women. I cannot tell you how many times in my medical practice, clinical practice, there were people post-MVA having a lot of TBI, post-traumatic brain injury type symptoms, and immediately I would put them on progesterone, and the recovery was remarkable. And it's not just right when a brain injury occurs. It is even 6 months, a year later. People sometimes show up to my clinic and to our clinic 6 months or a year later. Can they benefit from hormone balancing? You betcha. And you don't have to have a brain injury for hormone balance to make a huge difference in your ability to have cognition, clear speech, to trust yourself. I went through this. I started out with early menopause and years leading up to that, and I came out of it with hormone balance, okay? I did not sound like this 10 years ago, okay? So there's not just hope, there's actually a complete way out of this hormonal mess. And we have a program, My Hormone Masterclass, which is specifically designed to do a holistic, comprehensive approach for anybody to go through, get your hormones tested, learn about the role of hormones. It ain't just taking some hormone, guys. You gotta learn the bigger picture of how hormones fit in with your liver and your gut. So it's called My Hormone Masterclass, and there's a link up in the copy above and in the comment section for you to check out and learn more about My Hormone Masterclass. It ain't just about menopause, guys. It's about brain fog. It's about post-traumatic brain injury. It can be about adolescence, okay? So really importantly, that's the role of hormones. Second thing that causes brain fog, and somebody already guessed it, I think that was Teresa, was blood sugar. And I'm not going to go too deep into blood sugar, but I can absolutely tell you right now that there was, last week when we discussed what time of day are symptoms worse, people said middle of the night and early morning was the worst for a lot of people, but some of you were like late afternoon, early evening, and I'm willing to betcha, those of you that have brain fog right now, there's specific times of the day that are going to be worse. And I can pretty much say that sometimes the worst brain fog for me personally and many of the clients we work with in our main program, Transform Autoimmune, is that their late afternoon slump. Late afternoon slump, brain fog tends to be the worst. And that absolutely has everything to do with blood sugar. So if you haven't seen the training that I did about blood sugar and other trainings, please jump into the Facebook group, Transform Autoimmune, and look at the blood sugar unit in there. And that Autoimmune Table Talk of when hormone symptoms are the worst. There's just so much with blood sugar. Every time, and it's not just high blood sugar, low blood sugar, it's the swing between high and low and the swing between low and high that really causes brain fog to be worse. And what I'm going to tell you is that blood sugar mastery is a huge part of Transform Autoimmune Disease Naturally. It's main program. It's also a huge part of my Hormone Mastery class, because it plays such a role in hormone balance, but it plays such a role in brain fog that's in autoimmunity or hormonal problems. So really, blood sugar is really the second reason. The third is your gut health. And I'm really going to talk, the third reason is gut health, and I'm going to talk about gut health in terms of, and literally, guys, I could talk a week about this, but I'm going to just be very specific here, which is that there are recent studies now, just using Parkinson's as an example, is that there are two types of Parkinson's. This is an article that came out today. And one type, they call it brain started, and the second types of Parkinson's is gut started. They're starting to realize and notice, even in studies, that people with certain types of gut issues will develop Parkinson's, and there is definitely a lot of legs to the theory that gut bacteria and the products of these good and the balance between the good and bad gut bacteria and the role that they have in creating toxins, inflammatory factors that go and affect brain health. It is the beginning of studies around that, but it is literally a holy grail. And I was reading one of the interviews I had, one of the quotes I had was somebody saying, I did 3 gut healing protocols and even probiotics and all, and it didn't help. Well, to me, the way that we approach gut health, the order is freaking all wrong. I cannot tell you that how much money and time people waste chasing things like Candida, SIBO, or getting mailed in food testing done, or working with practitioners who really are not experts in dealing with food and the role of gut, autoimmunity, TBIs, things like that. That is why food mapping is key, because food mapping is a unique process we do in our program, Transform Autoimmune, and food has so much to do with it. And what I'm going to tell you is, if you're warring with certain food and you're guessing, that is, to me, the biggest shame and a waste of time. And you're dealing with infection, but yet not dealing with what's causing this environment to favor infection. So that is the root cause of gut problems. Number one is people not using data to identify what food intolerances is causing the environment to suck and favor the growth of bad bacteria and disease. Okay, so for me, it is a process of food mapping that we have perfected in our program, and it's life-changing. Wouldn't you want to know with just a blood test exactly which foods is triggering the environment to suck? That has to start first. Everything else that you layer on top, whether it's infection, probiotics, gut soothing protocol, all that needs to come after that. So the order is wrong, and so people will spend a lot of money on the back end, but food has a lot to do with it. So food mapping, knowing which food intolerances you have is causing that environment, is going to be really key. So I wanted to lastly talk about what's the role of mindset in brain fog. And I just got off an interview with Greg and his wife Jewel, and he's struggling with MS, and he's a man who loves to learn, who's developed so many programs and business, and have done so much in his business career, right? But him and his wife was talking about how he has trouble with his memory, and that was really, really difficult, because he became, someone who had a personality that was really people-oriented to someone who was really short and irritable. And it really affected their relationship, and it affected his self-trust. It changed who Greg was. And what I love about Greg's interview, which we hopefully will premiere in the next week or two, but Greg and Jewel really brought up a point, which was even the brain fog in MS can be improved. I want to repeat this. Even brain fog in MS can be absolutely improved. Why? Because their hormones can be balanced, okay? Their blood sugar can be mastered. Their food intolerances can be mapped out. And number 4, I mean, their freaking mindset can totally change in a couple weeks. Okay? So I really want to talk about that when there is the power of mindset. And you know, when you lose self-trust, it can turn you into someone who's very irritable, defensive. Okay? And you can be hiding behind that to protect yourself because you're scared that people are going to figure out that you have brain fog or you have memory problems. How many of you are resonating with that? Anyway, I hope that was super helpful. If you want to learn more about balancing your hormones and its role in brain fog, you can go to myhormonemasterclass.com. If you want to learn more about our program, please join our Facebook group, Transform Autoimmune Disease Naturally. If you're ready to actually end this hell, you can book a chat with our team, and there's a link to book a chat with our team to talk about which program's right for you. And that link is going to be in the copy above this video and in the comments below. I hope this was helpful, and if you found this to be helpful, this video will be posted onto our Facebook page and Instagram later on next week. When it does, please, and if you're watching this on Instagram or YouTube, please go ahead and tag someone in the comment section below, because they may not listen to you, but they may listen to me, and they may resonate with Greg's story or some of the comments we've had. So sharing's caring. Go ahead and share and put their name in the comment section below. That would be awesome. Thanks, everybody. I hope that was helpful. And if you want more autoimmune table talks, please write in the comments more autoimmune table talk. I would love to get some feedback on this. What was your biggest takeaway? Please write in the comment section. Remember, I don't want to talk at you, I want to talk with you. I'm Maggie Yu, MD, and you guys have a great day, everybody. Happy Thursday. And if this isn't Thursday and you're watching it, happy rest of the week. Bye, everybody.